So we wanted to look at disparities in care for patient end-of-life care, so care received at the end of life for patients who had advanced kidney disease but were not yet on dialysis. We know that there's been a lot of studies that show that dialysis patients tend to die in the hospital, tend to receive CPR, mechanical ventilation, more than other seriously ill populations. But we really wanted to focus on elderly patients who don't use dialysis because that is a little bit more unknown in terms of what their care looks like and if there's racial disparities in that. In the general literature, for the most part, racial and ethnic minorities tend to not have access to palliative care. They tend to not use hospice as much, and then they tend to receive more intense care at the end of life, die in the hospital. And when you poll the general public, most people do not want to have a medicalized death and die in the hospital. And so consistently we see that Blacks, Hispanics, patients tend to have more intense care, and so they're at a disservice for that reason. Not necessarily. So when we look at end-of-life care for the veteran population, it's similar. It's not, perfectly similar to the civilian population, but there's similar trends in terms of intensity of care at the end of life. It is very similar.